sharing today were emailed out yesterday to everyone who was on the Outlook meeting invite. But if you did not receive a copy of these slides, you can send an email to our team to request one, and I'll be sharing some contact information here shortly and providing you with that email address where you can send that and request the slides, and we'll be able to send that to you as well. But as Erica said, my name is John Wolf. I am part of the training team with Maximus. Maximus has worked with the Department of Medicaid, the Department of Aging, and the Department of Developmental Disabilities to create the Provider Network Management, or PNM, system. Joining me today to help provide you with an understanding of PNM are training specialists Jerron Robinson and Jamie Cindia, who you will be hearing from later in this presentation. They will also be here to assist with answering questions that you may have throughout our time together here this morning. Before I get into the agenda of kind of what we're going to cover today, I just wanted to share some important contact information with all of you. If you are, as you're working, or if you are having issues with PNM, such as processes being stuck or error messages appearing as you navigate through the system, really the best place to reach out to is the ODM Integrated Help Desk at the phone number listed here at the top of the screen, 800-686-1516. If the issue is with PNM, such as error messages or I can't move forward in the process, we've highlighted here that after you call that 800 number, the options to get to PNM technical specialists would be option 2 followed by option 3. That way you can get to a PNM technical specialist who can hopefully resolve your issue or potentially log a ticket for another team or another team member to examine further if they're not able to resolve it with you on the phone. Another way that you can get sort of tech support or help support with PNM, these 2 email addresses, really the first 2 that are listed here on the screen, can also be very helpful if you're experiencing those issues. Emails with screenshots of the issues or the messages that you're receiving can often help the tech support team understand the problem easier if they can kind of see what you're seeing in the process. Also, our training team email is listed here at the bottom of the screen, ohiotrainingteam@maximus.com. So as I said before, if you did not receive a copy of these slides via email yesterday, you can reach out to our team and we can provide that for you. So we'll be able to do that as well. So let's get into our agenda, what we want to cover for today. Our training is going to break down really into these 3 sections that you see on the screen. First, we're going to look at PNM from the role of an internal user, and most likely this is the role that many of you hold in PNM. This allows you to search for existing records in PNM, and we'll walk through the steps for how to search for those records in PNM, understanding when we get search results, what all the information that appears in the result panel means, and lastly, understanding the PNM workflow and how to access a provider record and obtain information for that record. For the second part of our training, we're going to discuss how PNM looks from the perspective of the provider user. We do understand that there are some of you assisting provider users as they try to complete different processes within the PNM system. The best way to assist someone is to understand what they're seeing as they access the system. So we'll be reviewing the provider dashboard and understanding the statuses that providers see in PNM. We'll also show how a provider can update information such as a change in address or a change in specialty, and then review in PNM the steps a provider would have to complete if they are enrolling for the very first time. In each of these first 2 sections, we will utilize screenshots of PNM to highlight areas of the system to understand that process. Once that process is complete, we're actually going to open up a PNM training environment where we can kind of look at these processes in action, understand the flow as we navigate or work between different pages. While there will be opportunity for questions throughout the first 2 segments of our training today, we would like to conclude our time with you by having kind of an open question and answer session today. So if you do have questions, either during the first 2 segments, you can make use of the chat feature in Teams, or there is that also virtual raise hand feature in Teams as well. If you'd like to ask a question verbally, you can do that as well. A member of the training staff will be monitoring Teams, both in the chat and the raise hand feature to answer those questions. But did want to let you know we will leave time at the end for additional questions. While we are trainers and have a strong understanding of the PNM system, unfortunately, we're not technical specialists. So we will do our best to answer your questions. But if they are related to a system issue, such as receiving an error message when completing a process, or if information is not displaying correctly in the system, for instance, we may have to direct you to contact the integrated help desk so that a technical support specialist can best assist you with getting those issues resolved. So let's start off on our first item on our agenda by looking at P&M from the perspective of an internal user, which should be the type of role most of you have in P&M. So when an internal user logs into P&M, the first page that they see typically looks like this screenshot we have at the top of the screen. There's no detailed provider information, but just really a message that welcomes the user to P&M and instructs the user to navigate to the menu to sort of kick off processes or begin actions in P&M. Before we do look at that menu option, I do want to go over the toolbar located up at the top of the page. Now, this toolbar, this kind of dark blue ribbon that appears at the top of the page, shows up on every page in P&M, regardless of what is displayed in kind of the lighter color section in the middle or bottom of the page. So if you're looking at a provider record or different information or somebody's address, that blue ribbon will always appear at the very top of the page. Well, we have a list of listed all the options here on the slide. There are two options that I do want to highlight that you would perhaps use more often than others. And the first one is the home icon, that icon that appears kind of over here on the left-hand side of the toolbar. What the home icon does, it will return you to this very page. So regardless of where you're at in P&M, if you're looking at other information or get to a point and you're like, how do I get back? How do I restart? By clicking on that home icon, it will bring you back to this very page, the first page that you logged in or you saw when you logged in to P&M. The other item I want to highlight up here in the toolbar is the Learning tab, or the word Learning. Now, this Learning tab contains a library of user manuals and guides to assist provider users in completing a variety of processes and tasks in P&M. If you are someone who is assisting providers in working with the P&M system, this page can be a great resource. And I want to just briefly look at that page for those of you who are assisting providers as part of your interaction with P&M. The learning page, as I said, you can get there by clicking that learning tab in the top toolbar. And this is a page that we, the Maximus training team, maintain by providing these different user manuals and guides. We have designed these documents to be specific and provide each action in an easy to follow step-by-step process for providers. Also, if you're assisting providers in completing different actions in P&M, many of which we'll cover in our second segment today as part of the provider view of P&M, this page can be that great resource, not only for you to use, but also to provide to the provider or guide them to for them to use as well. So we're always adding, we're always updating to the material on this learning page to try to provide those resources to those provider users. So for those of you who are assisting providers, these different guides can be helpful in that sense. But coming back to our home page, as an internal user, again, this is what our homepage looks like. Really no information that we see. It just kind of guides us to that menu. Before we get to that, I will let you know that there is a session timeout in P&M, and it's set for 60 minutes. So if your session remains inactive for 60 minutes, a pop-up window will display counting down the final minute before you'll be automatically logged out, or you have the ability to indicate that you're still working. So there is a 60-minute kind of inactivity within P&M that I wanted to mention as well. So our next step, as I said, as an internal user, is going to be initiating options for ourselves. And that, as the text indicates here, right on the home page, use the menu to navigate. So we are going to use the menu option located in the top left corner of P&M to initiate our processes. While there are a variety of options that appear on this list, I'm going to highlight the ones that you would probably use most often. The first one is the word home. That does the exact same thing we saw on that toolbar at the top of the page as the home icon does. By clicking the word home under the menu, it's going to bring you back to the home page, or that first page that you saw when you logged into P&M. The provider search allows you to complete a search for provider records in P&M using different search criteria. And we're going to spend a lot of time on the provider search because that is probably the one you use most often. There's also the owner search, which allows a user to complete a search for owners of a group or organization or agency. You can search specifically by the owner, and we're going to briefly look at that today as well. The provider directory, I did want to call this one out because a user does not have to log into PNM to use this feature. It is meant for the public to access and locate a specific provider, perhaps in their area, or locate a provider based on the types of patients they see or languages they speak, things like that. So the provider directory option here in the menu is accessible to anyone. You do not have to log into PNM. If you just come to the PNM URL and click on the menu option, that provider, provider directory option is available for any user. And then lastly, the words provider ed and training resources, provider education and training resources, what that's shortened for. That also just takes you to that learning page that we looked at previously. So it does the same thing as the word learning in that toolbar at the top. Will take you to that list of user guides that follow or guide a provider user through different processes in PNM. So from this menu, the first option that I want to take a look at today is the owner search. And here's what that page looks like. So this does provide an opportunity to search for specific owners. As I said, an owner of a group, organization, or agency, we can look for those specific owners in PNM. If it is an individual owner, we can enter criteria such as first name, last name, or tax ID. Any of those you can put in, doesn't have to be all. Or if it is an organization owner, we can enter the organization's ID and perhaps that organization's tax ID. If you do enter a tax ID, that's an exact search field, so it's only searching for that specific number. Whereas if I just put in a first name or a last name or maybe a part of an organization name, PNM is going to search kind of for all of those names. But if we put in that tax ID number, it's only searching for that specific tax ID number. But once we enter our search criteria on this page, we can click search. Results will appear right below where we entered the search. So in this example, I just searched for a last name, and any owner with that last name, those different provider records appear in the search results at the bottom of the page. If we wanted to review or take a look at that specific provider's Medicaid record, we can click on the review button here, and that will open up that file for us to take a look at. Also, you'll notice, and we'll see this in other searches that we complete, up here kind of in the top right side, we have a Excel icon and an Adobe icon. PNM does allow you to export these search results. So whether it's the owner search or the provider search that we're going to take a look at next, you have the ability, if you wanted to, for any reason, to download those in either an Excel format or the PDF format in Adobe if you wanted to have a list of those search results that come up on your search. If you needed to begin a new search, under the owner search, you can just click the clear button up here at the top. That will clear out the criteria that you previously entered, and you'll be able to begin a new search. But I want to spend most of our time on the provider search in this segment today, because that's probably the one that you're using most often. If you need to look up information, or perhaps those of you helping providers are kind of wondering, they've submitted it, what's going on, where's it at in the process? All of that can be found as an internal user through this provider search option. So again, we're selecting the menu in the top left corner, and then we are selecting the provider search option. Under the provider search, it is going to allow for any provider's Medicaid record to be searched for in PNM. Search results, which we'll see on the next slide, show many details about that provider, including a real-time status of their application. Now, in searching, there are really two types of fields that we're looking at. Now, this is this provider search page, so you can see there's a number of different criteria that we can search by, and you just only have to enter at minimum one item or one criterion to search for. And I'm going to talk a little bit more about that. But really the fields that we're selecting, there's two different types of fields. First, we have the blank boxes. So you can see there's a number of different boxes that are just blank up here. Anytime we see the blank boxes, it requires us to type in text, type in something that we're searching for. So in this case, I've highlighted the provider name. If I wanted to search by a specific provider's name, I need to type that in. Or if I wanted to search by the provider's Medicaid record or NPI, I need to actually type that in. The second kind of search field in there is the box that has an arrow located on the right-hand side of it. Any of these search boxes that have that arrow located on the right-hand side of the box indicate a drop-down menu which contains pre-filled options to choose from. So if we're searching for specific statuses, things like that, those are pre-filled options that we can select from. Also ones up here, provider type, application type, those are pre-filled drop-down menus that we would select from. In addition to that, there are some criteria that require previous boxes to be filled out within a section. What do I mean by that? Well, if I wanted to search by a specific provider type, in this case, I'm searching for an audiologist individual, a type 43. In order for information to appear in this provider type drop-down menu box, I have to fill out other fields within the search. So in order to get options to appear in the provider type, I need to fill out a category. In order to fill out a category, I need to fill out an application type. If I just try to come in here to the search and select the provider type drop down, nothing would appear in there until I have these first two sections filled out. And that's what I know it's kind of hard to see on the screen, but that's what these little I icons or information icons, the letter I with a circle around it, will inform you of. So if you hover over your mouse when using PNM of that icon, it will inform you that that needs to be filled out in order for the category. So in order to have a category, I need to have application type filled out. In order to have a provider type, I have to have both of these filled out. So I just wanted to call that out. If you are perhaps searching by a specific provider type, in this instance, you would need to make sure that both the application type and category are filled out for the provider type. But once all of that is entered, regardless of what we're putting in, whether it's searching by type, searching by name, a Medicaid ID number, an NPI, whatever it may be, once we have our search criteria in there, we just need to click the search button at the bottom of the screen. And right below where we click search, which was right here, the search results will display. And we can see kind of a wealth of information that comes up for the specific provider, and also those icons that I mentioned earlier, Excel or Adobe kind of icons. If we wanted to export these search results, we can do that as well. The first column has a hyperlink. You'll see that kind of in that blue text with the word review. And what review allows us to do is open a read-only version of the provider file. It allows us to view information on that provider's record without making any changes to it, just kind of for viewing purposes, allowing us to get that information. If our search results bring up many results, so in this case, I searched just by that provider type, and we can see up here at the top where it says row count, it tells me I have 701 search results. So if we have a lot of search results, you'll see multiple pages listed here at the bottom of the screen where you can navigate through the different pages or go back up into your search and maybe refine your search to kind of narrow down. I do see a question in the chat that I can answer
Yeah.
while you're working on that. It says PAA 6 staff do not have many of these menu items. What we're seeing now would be the internal role. So it may be dependent on how you are set up in PNM, kind of what role you're assigned. I'm not sure if you have been assigned an internal user role or if you have, for some reason, been assigned a provider user role, but that could be or account for the differences that you may be seeing from what I'm showing versus what you may have on your screen in PNM. If you do have a question about your role or need to change roles, something like that, perhaps you can reach out to that integrated help desk and they can take a look at that for you. And while we have a moment too, if there are any other questions on anything that we've covered, you can either virtually raise your hand or type them in the chat as well, and we'll be happy to answer those as we work through these technical difficulties and make sure everybody gets set back up and can view the presentation. I see a question in the chat from Barbara asking, what is conversion under the PNM status? That's a great question. We're going to cover that in a couple of slides, but since I have a moment, I can go ahead and speak to it now. What conversion means, conversion is similar to the maintenance that we see on here. And really those two indicate that a workflow is not in progress. Everything has been completed. No one's reviewing the file. So if we ever see it in maintenance or conversion status, it indicates that there's no active workflow. The reason for the two different statuses, maintenance indicates something has occurred since PNM has launched October 1st of 2022. Somebody's gone in and maybe it's been a new enrollment application or they've completed an update. They've done something in PNM since the system is launched. Conversion indicates that the data was converted from MITS to PNM over a year ago, by October 1st of 2022, but nothing has been done in PNM as it relates to that record since that time. So they're basically the same thing, maintenance and conversion, meaning it's not in an active workflow. But when we see the status of conversion, that just means the data has been converted from MITS over a year ago, but nothing since that time has been done on that record in PNM. This is really the reason for those two statuses. And again, too, while we have some time, I can kind of walk you through here. So we see the search results on this page, and I know some of you are still working through technical difficulties. But for those of you that can see, you can, as I mentioned, we get a lot of information from the search results that we can see kind of in this table format. We can see the provider's name, the provider's type, NPI, that status that I was just talking about, and we're going to talk about in a little bit more detail in just a bit. This column here that says assigned to. It's about the fifth one or sixth one in there. Assigned to just indicates if the record is in a active workflow, meaning it's being reviewed. And if it is being reviewed, it will list under assigned to the user who is reviewing that. So if it is an enrollment application and perhaps the ODM enrollment team is reviewing it, if somebody is specifically assigned to or reviewing the record, their user ID or Ohio ID will appear under that assigned to. So the assigned to just indicates if there is an active workflow going on, if it's a manual review process, and who is specifically reviewing or who has initiated that process is really what that assigned to column is. We can also see the specialty column. That's going to indicate the primary specialty indicated by that provider. So even if they have secondary specialties, whatever the primary specialty indicated is, that's what appears in this column. We have the Medicaid ID. So if one has been assigned, that will appear in this column. If they are in the new enrollment process and have not yet received a Medicaid ID, that field will be blank. So that's kind of another way to understand whether they put in a new enrollment application. Then we have the enrollment status type, whether active or inactive, and kind of based on both, there's usually an enrollment status reason that follows it. If they are inactive, usually we're going to see the reasons why they're inactive in this case. And I see the note from Angela that everybody's back up and running, so that's excellent, perfect timing. So again, just to recap, these are the search results after we've completed the provider search. We get the results at the bottom of our page. The very left-hand column, it appears in blue text. That's a link where the word review is. Clicking review does not begin any sort of specific process. It's only a review of the file. If we have multiple search results that require multiple pages, those are indicated here at the bottom of the screen. And then if we needed to reset or redo or complete another search, we have that clear button available to us at the top of the page. So we can click on the clear button if we wanted to begin another search of a provider. That question came up, and I did mention we were going to discuss the status column. So that's the one that you see appearing here, kind of the fifth one in there, the PNM status column. Now this status column appears or displays the internal statuses. And the reason I say internal, they're a little bit more in depth. When you're an internal user, you can see a little bit more information, whereas we'll look at later the provider statuses that they see on their dashboard are a little bit more generalized into kind of what's occurring. So the two statuses that I mentioned earlier I've highlighted here because you probably see these often when you do a provider search, and that's maintenance and conversion. And these are really two that you want to see in there, because what that indicates is that the application or the Medicaid record is not in an active workflow. It's not being actively worked by other departments, by ODM, anything like that. If it's in a conversion or maintenance status, it means all workflows have been completed. So maintenance is ideally what we want to see. It indicates that something has occurred in PNM, whether it was a new application, whether it was an update, but those processes have all worked their way through, and being in maintenance status means anything a provider can go ahead and initiate something new, like an update, revalidation, anything like that. And really the difference between maintenance and conversion, maintenance just means something was done since the PNM system launched October 1st of last year. Conversion just means data was converted over from MITS a year ago, but that provider has not completed any sort of process in PNM. They haven't gone and updated any information or completed a revalidation or anything. Basically, they haven't touched their Medicaid record in the last year since the PNM system launched. I do want to highlight a couple more. I know we mentioned A couple of them there. Here are some other common statuses, which are sort of at the beginning in the case of new or at the end of the enrollment process, which you may see here a number of different times. So if we're seeing a new status, that means a new application has started and it's being worked on, where the rest of these kind of indicate the end. We've talked about maintenance and conversion. Also, if a provider has been terminated, denied, suspended, or disenrolled, those are kind of statuses that are at the end of the process outside. The workflows have been completed and therefore they've been denied, termed, they voluntarily disenrolled. Those could be some common statuses that we see displayed there on the page. Some statuses that appear under the PNM status column are ones related to manual processes being completed by different users or different user groups. So here's a list of statuses that you may see listed as a PNM status while searching and kind of which department is completing this manual process. So for instance, if the provider is completing something, maybe their enrollment application, maybe they were sent back an application during the review process because they need to provide more information, you would see statuses such as provider data entry, or if they're in the process of doing a reconsideration, that's a provider one. So if it says upload reconsideration request, these are ones being completed currently by the provider, meaning that they would need to complete something. If you also see, statuses that say provider screening or provider review, those are statuses being completed by the Ohio Department of Medicaid enrollment team. So if you see those statuses, that can indicate enrollment has that file and they are completing reviews. And so I've highlighted some other ones, such as the site visit group, credentialing group, compliance, or even tech support on some of these different ones. If you see these listed in the PNM status, kind of relates back to which group or which users within that group are completing different processes. So there is a wealth of statuses that appear kind of on that internal side, just because it's going to list kind of every status that an application goes through. And I see a question in the chat that says, what is data received and saved from SI? Also included on the individual, or excuse me, on the internal statuses are automated statuses that happen in PNM. And we'll take a look at a couple more of those, but data received and saved from SI is an automated status completed by PNM. PNM is working with kind of outside vendors or outside groups that have data information. So that's an automated status that's completed by PNM. And usually that you may see that, but the next time you search again or refresh your search, that may move on to something else because it is an automated process happening in PNM. And I'll talk a little bit more about another way to kind of view those automated processes in PNM. So coming back to our search results, as I mentioned before, we really have an ability to do something after we get the search results, and that's that link all the way over on the left-hand column that says review. This allows us to go in and view information for a provider record that we are searching for. So from our search results, depending on, again, what criteria we put in and how many results we receive, we want to locate the provider that we want to see additional information for and click on that hyperlink that says review for the corresponding provider on the list. So I'm going to click the review button, and what that will do, it's going to take me into that provider's Medicaid record or the application that they completed, whether that was prior to PNM or in PNM, all that information will still look the same and show up in here. So we can navigate through that provider's record through our navigation bar that will appear at the top of the page. And that's what we've highlighted here in the screenshot. There's really two ways to navigate through a provider record. We have these different icons that appear here at the top. These are all clickable, and the name of the specific page is listed below the icon. So if I wanted to go to primary service address, I could just click on this icon and it will take me to the primary service address page. Another way I can navigate is through this menu up here that says jump to. It has an arrow on the right side. So if you recall before, we talked about the provider search. Anytime we see that arrow, indicates a pre-filled drop-down menu. So I can click on the drop-down menu, and all of these same page names will appear in the drop-down menu. So that's another way that I can navigate. Either clicking on the icons or selecting the page name from the drop-down menu will get me to that page. Also want to point out the kind of yellow box up here. That indicates the page I'm actively viewing. So in this particular screenshot that I grabbed, I was viewing the provider information page. If I was viewing that primary service address page, it would be highlighted in yellow to indicate that's the page that I'm viewing. Each page also has a title that appears at the top of it when you're on that page, so you can also understand the page that you're viewing that way. Then we have a couple of navigational bars. We have the next button that will take us to the next page on the list. So if I'm on provider information and I click next, it will take me to primary contact information. So if you are looking at pages in sequence for how they're listed up here in the navigation bar, that can be helpful, or you can just use the bar itself to navigate between pages. If for whatever reason you needed a PDF copy of the provider's application or the provider's record, you can obtain one by clicking the Generate PDF button, and that will generate a PDF document with all of the provider's information on it if you needed that for any reason. Another area on the provider's record that I do want to highlight is at the very top of the page. So right above where I just showed that navigation bar, we're at the very top of the page. And you remember earlier when I mentioned this kind of blue bar or blue ribbon appears on every page, regardless of what you're on in PNM. So here it's at the top, and then right below that is kind of this darker purple section. We call this the header. The header at the top of the page can provide some details about the specific provider. So once we come in here, we can double check that we're viewing the correct provider record, because we'll see the provider's name, Medicaid ID, and NPI number. But the header can also provide us additional information if we click this little blue button in the header that says more. It's going to expand more details. So if I click on more, now it's going to expand with additional details about that provider. I can now see their provider type, application statuses, enrollment status, all of that here. I can see over here on the right-hand side, their effective date or their revalidation date, all listed on here just by clicking on that more icon to expand those details in that header. And again, that's located at the very top of the page, just right below this toolbar or this blue banner that appears at the very top of every page in PNM. Another feature that's in this header is the orange button here that says notes. Now the notes button will also display any notes previously entered or that need to be entered by internal users regarding the provider. So some notes that you may see in there, if a application was sent back to a provider for additional information, the enrollment specialists or credentialing coordinators are usually instructed to add notes so internal users can see why it was sent back to a provider. And what additional information is needed. So that's something that could be in notes or really any other internal user notes that have been provided. And you can locate those under that orange notes icon in the header. So coming back now to page navigation, I mentioned that toolbar or navigation bar at the top. Here we see it again. It's highlighted in yellow. I'm looking at the provider information page, and here it says provider information to also indicate I'm looking at the provider information page. Regardless of what page we're looking at after clicking that review button from the search, we are not able to make any changes. So things are grayed out. We're not coming in here to make changes. Review is just a read only, meaning I cannot make any changes to the provider record, but I can view it for informational purposes. So the provider information is grayed out. I'm not able to change anything on that page. But if I wanted to go to another page, again, I can either click the icons up here at the top or select the drop-down menu to get to another page, such as an address page. Here we're looking at the other service location page, so we can see, in addition to the primary service address, if there's any other locations that provider has indicated that they provide services, we can see that under this other service locations page. And I got there either by selecting, and there is a scroll bar here too. I can drag this scroll bar over to ones for other icons. I can either click it or get to it from the drop-down menu. Same for specialties. I can just locate the specialties icon or the drop down. Here I can view the specialties page and see the specialties for the provider. Now, one thing about the specialties, as you can see on this screenshot, we've got the same specialty listed twice. 239, specialty 239 is listed on here twice. But as we kind of take a closer look at it, one thing that we can find on the specialties page is any inactive spans. So we can see that this specialty 239 was ongoing from the beginning of January 2013 through the end of December 2014, and now it is inactive. They no longer have that specialty. As we can see, that started January of 15 until now and this infinite date. So we can see inactive spans on here, or we can also see whether the what specialty is indicated at the primary. Under the primary column, it'll say yes for the primary. So we can view that information in PNM. And really any of these pages, I've only highlighted a couple, but any of these pages on the icons, we can select and view information or get there from the drop-down menu. Now, we had the question of different statuses before. I do want to highlight an important page that is available to internal users of PNM, and that is a page called Workflow Steps. It's if you're looking at that navigational bar that I just highlighted, it's going to be all the way over to the far right side, or really the last item that you can select on the drop-down menu, but it's called Workflow Steps. And here we can see every task or every process that has happened for this particular application or this particular action by the provider. Each step in the workflow is listed along with being date and time stamp. So if a task is still ongoing, the end date column that we see over here on the right-hand side will be blank, indicating that is still in process. Kind of two things, and again, these are some of the statuses I know some of you mentioned earlier, but I do want to highlight, really the username column is going to indicate some important information for us. So if under the username, we see admin core as the username, that indicates an automated process being completed by PNM. So we had this very one asked about earlier, data received and saved from SI. That's an automated process that PNM has completed, and we can see the start date and end date are the same time. So that's something that usually occurs quickly. It's a quick automated process. It's doing a check if something is there, if something's not there, and then moving forward to the next task. And we can see on this particular list, the majority of the usernames are listed as admin core, indicating these are automated processes. Also under username, we can see a specific number. That would indicate a manual process. And what that number is the user who completed that process. So here we've highlighted provider review, which if you remember from our slide earlier is a enrollment process. So we have the user ID of the enrollment specialist who completed that provider review process. So again, this page is called Workflow Steps, really allows us to see every item that occurred in the workflow. And even up here, we have this drop down where it says select a workflow. So anything that has occurred, any submission from the provider, we can view under workflow steps, whether that's been an update 3 weeks ago, and now there's a new update today. Those are separate workflows. So we can select those from that drop down menu here at the top of the page to kind of review. And typically PNM will show anything current or the most recent one is what displays. And you can go back and look at past ones by clicking the drop-down menu as well. So I do want to pause here and open up for questions to see what questions you may have about the internal role use of PNM. And really, I think most of it is going to be based on that provider search that we looked at, clicking review, going in and reviewing information about the provider. I do see a question in the chat that Jaron answered, but I'll speak up to it for everybody to hear in case you aren't following the chat. It says, do providers receive messages through PNM when they are due for revalidation and what they are to submit to complete that process? So providers do receive notifications, not just for revalidation, for other things through PNM. Those notifications are sent to the person or email address that is indicated on the primary contact information page, only to that individual, or there's a spot for multiple email addresses, it would go to each one. So even if that primary contact information listed on that page is different from perhaps the provider administrator, something like that, that's where the information goes to whomever is listed on the primary contact information page. When it comes to revalidation, notices are sent out 120 days prior to the revalidation due date, and then every 30 days leading up to that date. So at 90, at 60, at 30, they'll get a notification. It gives them the information. In there, we do have user guides for how to complete a revalidation within that learning page as well. But those notifications do go out to that user. So I don't see any other questions in the chat. And what I'm going to do is I'm going to pass things over to Jamie Cyndia, one of our training specialists, and we're going to kind of take a look at PNM itself, everything that I've kind of talked about. I know sometimes when we look at it in still screenshots, it's maybe a little bit hard to understand how things flow or move, and Jamie's going to open up PNM and kind of walk through those processes. So Jamie, good morning to you, and I will pass the mic over.
Hi, thank you, John. Appreciate that. So what we're going to do is I've got two tabs open on my internet browser. One is the production version of PNM, and the other is the training region of PNM. So before we get into the internal user view that John just went through with us, just wanted to touch on what that learning page looks like in the categories that it has. And you can easily see from what I'm showing that I'm not even logged in to PNM, and I still have access to each of these tabs at the top. So if I were to click on learning, walking through a provider with something, these are the categories that you would see. Existing users and new users down there in the middle with quick reference guides above that, provider category user guides. Frequently asked questions is a really good one. It's the very first one. And if we scroll down a little bit more to the bottom, we've got a couple more sections as well. So just wanted to show you, that you don't have to be logged in. You can just click on the learning tab right at the top, and it will present you with this same exact information. So I am going to flip tabs at the top to go to the training version of PNM because as the training department, we use fake information and we need to practice with that in a training environment so we don't disturb anything real. But this particular view that we're looking at, I am logged in as an internal user. So, when we talk about internal versus provider side, internal would be something that the provider does not see. So an internal user of PNM would have this view and this access to it. So as John showed in the presentation, when that internal view is opened, it's kind of blank. It just says, welcome to Provider Network Management System. Please use the menu to navigate, which we will. So we do still have the learning tab and all of those things at the top, but the top left is what I want to really focus on for just a moment here. And if we click the menu, there are a variety of things that show up under it. I do want to focus on about 5 of them for our demonstration today. Going to highlight them, but really focus more of our demonstration on that provider search. So just browsing through this list here, this home button, when we click on it, takes you just right back to this home menu that says, welcome to provider management. Please use the menu to navigate. So we'll take you right there. The provider search is how you can search for a provider to click that review button, get in their files, see what's going on with it. The owner search right below that is if you did need to search, by the owner, you could enter that particular owner's name in or ID, whatever you might have to pull up that file or that record. Below that, we have the provider directory in which you can search for different providers, based on different patients that they accept, different specialties, things of that nature. And then down here at the bottom, I do want to point out this provider ed and training resources. So it's kind of like education and training. That will take you right to the learning page, right back to it. So if you want to click the learning tab at the top, you can get to the same place as where you would go if clicking this provider ed and training resources. So a couple places you can get to it. But for the bulk of the demonstration that I do want to show you, I'm going to click on provider search because this is how we're going to get into looking into that file, seeing those workflow steps, and all that John went through. And just a reminder, we do have the presentation emailed to you, so you will have access to all of these slides showing screenshots of what I'm showing you right now. So as John went through, we've got these different fields. Some of them you just type right in. Some of them are drop-down menus. And depending on what you're starting with, it might prompt you with another thing to fill in. Okay, so for example, let me use move something on my other screen. For example, I'm going to start with application type. So if I click the drop down for application type, I do get these different options that I can look for. For my demo, I'm going to click on standard. When I do that, you can see that it takes me to the category right next door because it needs that now in order to narrow down these selections. So if I click on the drop down for category, today for our demonstration, I am going to click on individual, although we've got some other options there. And then look, it brings me right over here with this kind of blue outline around provider type, in which if I click that drop down, I get these, the number options of the providers. If you know those really well, or if that's easier to, search this navigation bar with, whatever works for you. I particularly, if I know the number, I look for the number because it seems to just get me there faster. So for our example here, I'm going to use standard application. I'm going to look for an individual, and I'm just going to go ahead and look for a provider type 20 physician/osteopath individual. So I don't have anything real specific, right? I'm not looking for a particular person. I'm kind of looking for a variety of things to show you for our demonstration. So it's going to pull up a bit of search results. So I'm scrolling down to the bottom, clicking search, and it's loading, as you can see, and it gives me a row count. There's quite a bit. So I'm going to scroll down here, and our options that we chose are still up at the top. But you can see a variety. These are in alphabetical order. So we can see the provider names. I'll start with A over here and then go to B. But the status column is in the middle. So we do have a variety of different ones. Just to remind you, the on slide 17 is where those statuses are listed for this. So if you see one that says new or maintenance or provider screening, conversion, whatever it might be, look on slide 17. It will give you a nice definition to put you in the right direction. So there are all individuals, all physicians/osteopath individuals that I just brought up search results for. So we do have a variety of PNM statuses that we can see. What I'm going to do is go ahead and click on one of these to review, to look at the notes, and to get to that workflow page and things of that nature. So I'm going to go ahead and click on Amy Cox right here. So we can see that she is in maintenance status. So what does that mean? She's not in an active workflow, and the provider is active with Medicaid. So we can see that too if we were to go all the way to the end of this row. We see that it's active. So to look into this file as an internal user, I'm going to click review. Give it a moment. Let it get its beat together. And we can see up at the top in this dark purple, we've got, in case we just need to double check ourselves, I need to do that quite often when I'm looking in and out of files quite a bit. So if we need to check who are we looking at, I need to be looking at Amy Cox. And so, yes, I am looking at that. If we go to the right side of this purple box, we see the notes button and the more button. So the more ... will expand to provide some more information, kind of at a snapshot or at a glance of what's going on with this particular one. And the notes. So there may or may not be notes in here, but depending on what the record has gone through, screening, review, different types of processes, and people will put notes in there sometimes like screening's complete or, something of that nature. So let's look at Amy Cox, see what kind of notes we have on Amy's. So we do show that there are two, one from January 20th of 2022, one from August 22nd of 2022. We've got the note, or I'm sorry, not the note, the timestamp as well. You can see what type of note it is, the user that put that in, the workflow step that it was related to. So I know these notes aren't great and they're from the training environment, but while they're testing these particular records, they put notes in to test the functionality of that. So this one has two, but someone was being kind of funny and put blah, blah, blah on the notes when we were testing, but this is an example of two. So I will close that. I want to go to the workflow steps page because that will be useful to figure out who's had their hands on this one, what they've done with it, things of that nature. So I particularly prefer to use the jump to drop-down menu. It's just a lot nicer for me, although this one's not loading for me at this moment, so we'll skip that part. We'll use the navigational bar to get to the workflow items page. So it will put the yellow box around the one that we are currently viewing. So right now we're on provider information. I'm going to scroll. It's at the end. I'm sorry if this makes you a tad dizzy. Normally the jump to is working, but I'm not sure what's going on with that. So the workflow steps. If I click on that, or I could use the jump to, it does highlight that now we're on yellow on this workflow steps page. And if we scroll down, we can see that this one has a lengthy list of workflow steps. But in the middle here, we've got the username who was, had their hands inside of this Medicaid record doing a certain task that was performed on a certain date and time and ended on a certain date and time. So, for example, this one right here, Jamie Enrollment, that username, that was one of mine. I sent this particular record through while I was doing the review. So getting either update reviewed or maybe it was review for new enrollment, but you can tell that I had done something to that file or record on that date and time. So this is a good one to figure out, what's going on with it as an internal user. And the workflow steps page is very, very helpful to see who has been using it, what's been done, just to get an idea of where things are at. Of course, there are other pages that could be looked at as well. Let me see if this dropped to, okay, now it's loading. Maybe it just took a minute to load or whatnot, but this jump to menu does allow you to get to it a lot quicker than moving that navigation bar. So you can just go right to the workflow steps page and it would take you right here. So any questions that I can answer while we have, excuse me, didn't mean to do that, while we have the PNM open. All right, I don't see any hands up. If there are no questions at this time, I'll be back for a second demo for the provider side after Jerron goes through that. So, Jerron, I will turn it over to you when you are ready.
Thank you so much, Jamie. If you wouldn't mind just giving me a thumbs up just to let me know that you can hear me, would greatly appreciate that. Awesome. All right. So John walked us through the internal process and what you guys will see for the most part on your end, some of those functions internally. And then Jamie actually showed us those things within the PNM system. Now let's look at PNM from the perspective of a provider user. Since you're going to be assisting providers, maybe a good idea just to kind of have knowledge of what they're going to see and they're going to have access to on their end. So let's take a look at that. The first thing that we want to do is just to really define what the PNM roles are. So what providers are able to more or less set themselves up as within the system. And there are two of them. There are two main roles that a provider can hold in PNM. They can either be a provider administrator or a provider agent. Now, the administrator, we want to really look at that individual as more or less like the manager. They're the overseer of that Medicaid record. So that's the role assigned to a user in PNM that's going to give them the most access. They're going to have access to everything as it pertains to, as it relates to that provider record. So they can do everything. They can create those new enrollment applications. They can perform updates to that provider record. They can, of course, do revalidations. They can do other tasks as well, whether that's submitting a claim, whether that's submitting a prior authorization request. But they also have the ability to assign various other users to do other kinds of work for that Medicaid record also. Now, there is one caveat with the administrator role. There is only one administrator per NPI or Medicaid ID. So there can't be multiple admins for the one Medicaid ID. Now, that single user, that's an administrator. They can be the administrator for multiple providers. Maybe there's 10 providers and they're the admin for all of them. Or there can be a situation where maybe there's a lot of providers in the group and you don't want to be the only one serving as the administrator. Maybe there's 100 providers. You don't want to be responsible to have that type of oversight for all 100. Maybe you take 50 and another provider administrator takes the other 50. But there will never be an instance where at the same time, two individuals can be the administrator for that one Medicaid record. The other role is that of the provider agent. This is assigned after there's an administrator on that Medicaid record. And this is an individual that has some access, not quite all of the same levels of access as the administrator, but they do have some access to complete specific actions. Again, such as updating a provider record, they can do revalidations, claim submissions, they can do correspondence, review reports, things of that nature. Really, the one thing that they are not able to do as an agent is going to be the ability to actually create those new enrollment applications and get those submitted. Outside of that, the agent can essentially do everything that the administrator can. Now, obviously, not being able to create an enrollment application and to get that submitted over, that's not like a small thing that they're not necessarily able to do. That is a very important aspect. Obviously, a provider wants to be enrolled in the plan. Someone has to do that for them if they're not going to be doing it themselves. And agents just don't have that level of access. So they can do some enrollment items, which we'll discuss. They just can't start the application from scratch. Now, once that application is on file, it's been submitted, reviewed, and approved, then the agent has the ability to make updates, to make changes, do revalidations, things of that nature on that Medicaid record that is already on file. Now, the screen that we're looking at now, obviously, is the home page, also known as the dashboard. And while we looked at some statuses on the internal side, there are also statuses that providers will see on their end in the status column. And these change depending upon what's going on. They're updated in real time. And let's take a look at what those statuses are. So you've got not submitted. It just basically means that you've initiated something. It just hasn't been submitted over to ODM to be reviewed. And of course, conversely, submitted means that it has been sent over to Medicaid for review. We've got approved. This means that the application has been approved for initial enrollment. However, there may still be some other workflows that the application needs to go through before it gets to a final approval, or otherwise known as a complete status, which we'll look at the bottom. Of course, if it's denied, that means that Medicaid has denied that initial application for whatever reason. Providers will often see RTP, or return to provider, as a status. That means that something is missing, something is necessary or required by ODM that the provider themselves will have to submit or complete in order to get that application approved. We've got terminated. That means that this was an existing active provider, and for whatever reason, ODM has decided to go ahead and terminate their involvement with the plan. Inactive, they're just no longer active with Ohio Medicaid. And then lastly, what I mentioned earlier, as an aside to approved, is the complete status. So this is where the application not only has been approved for the initial enrollment, but it's been completely approved. It's no longer in an active workflow, and that's where that Medicaid ID will appear on the dashboard. Now, in order for an administrator or even an agent to initiate any kind of process in the system, they'll first have to locate the provider in question. As you can see here, this screenshot shows that there are multiple pages. This here is a drop down where you can kind of toggle back and forth between the amount of records that you want visible on any single page. So that's the first thing, is just locating the provider in question. And then once you found them, you're simply going to click on the corresponding hyperlink, whether that's the hyperlink underneath the registration of the reg ID or the actual provider name. Either or, doesn't matter. They will both take you to the same place. Upon clicking on one of those hyperlinks, the next screen that you'll see is known as the provider management homepage. And there are really three sections to this page underneath that manage application section that become important for the providers. The first one being the enrollment action selections section. There's a section there for program selections, and then finally the self-service selection section. Now, underneath those selections, there is a section of the page. You can kind of see it right here in this orange colored shaded area, the My Current and Previous Applications section. We'll actually look at this section here in detail in a few moments. Just wanted to point out that that's underneath the 3 sections in the Manage Application section. And the reason why this screen is so important is because this is where you initiate all of the processes. This is where you're able to view that Medicaid record. This is also where you're able to initiate updates, whether that's an update to change the address, specialties, maybe it's time for revalidation. Your 3 years is up, or the 5 years is up for that provider, and so they need to revalidate. This is also where they're able to see messages as far as viewing correspondence, initiating prior authorizations or claims, things of that nature. All of that is initiated from this provider management homepage. Now, if you were to expand those 3 sections, it would look a lot like this. You would just hit that plus icon in the correlating section in question, whatever section it is that you're going to be looking to do work on, and then you will see the options available for you. In the enrollment action selections, this is where you'll initiate your updates. And that could be the address is different. There's a new location that providers, just had built that they're going to be using maybe as a satellite office. This is where you'll see the option to begin revalidation. You only see that at certain times. It's only visible when the provider is within 120 days of their revalidation due date. And that revalidation due date is also listed on the dashboard on the far right-hand corner of the screen. So I know that right now it says begin ODM enrollment profile update. However, if it were up for revalidation, of course, again, when that provider is within 120 days of that due date, then this does not appear. Instead, it would say begin revalidation. And of course, within the revalidation timeframe, if things need to be updated, then that's, of course, when that provider would make those changes to the Medicaid record. The program selections is only visible. It only really has information in there at certain times of the year. Usually this is when maybe an ancillary program of Medicaid's is doing open enrollment or something like that. Otherwise, for the most part, providers, if they were to try to expand this, if it's not during one of those, time frames for open enrollment for a particular program, this is just going to be blank. And then, of course, you've got your self-service selection section. That's where you're able to, pretty much do everything non-enrollment related, whether that's claims, hospice, looking up correspondence, just viewing the provider file, so on and so forth. We talked a moment ago about the My Current and Previous Applications section right underneath those 3 sections that we looked at on the previous slide. Now, within this section, that's where providers can see just a little greater detail when it comes to their application, or maybe they submitted an update, or even they submitted a revalidation. If they wanted to kind of check to see what was going on with that, right here in the PNM application status section is where they will see what that status is. Some of the statuses that will be visible are the submitted. It just means it's been sent over for review. Could be processing, which is what it's showing in this screenshot, meaning it's been submitted. It is currently being reviewed, but it has not been completed as far as those reviews are concerned. Could show denied or cancel if the individual just canceled the update, or in the case of it being denied, the application simply was denied. Or sometimes you'll see, of course, approved or complete, letting you know that the application has gone through all of the necessary processes, steps, and a determination or approval has been made. Also want to call your attention to these question marks that you'll find in blue. Providers can hover over those question marks in blue and they'll get a little bit more information about that section. That's not just here in this particular section that we're looking at, but anywhere on that management homepage where that blue question mark is found, they'll simply be able to hover over that to get a little bit more information about what's going on, about what that section means. On the far right-hand side, there's also this workflow complete category. Let's take a look at that a little bit further in detail to see exactly how that helps providers as well. So as you can see in this section, you'll only find Ys or Ns. The Y means that that workflow has been complete, it's finished, it's done. Or if it says N, that just obviously means no. The workflow has not been completed. It is still in an active workflow. Now, the reason why this becomes important for providers to kind of know is when it is in an active workflow, fortunately, there aren't any abilities for them to make any kind of changes. So if they wanted to submit a new update, but it's already in an active workflow, it's already currently being reviewed, whether that's an automated process just within the PNM system, or maybe it had to go through some additional review or screening, an actual set of eyes had to take a look at that update or at that submission. The system doesn't allow for those additional changes to be made while it's in that active workflow. So if a provider was to ever, kind of be confused, or they're wondering, how come I can't do anything? I was told that I needed to click the hyperlink to go to the provider management homepage and expand that enrollment action selections option, but it's blank. Nothing is there. Why is that? Chances are it is in an active workflow, and this N, or whatever you see actually, or what they see in this column, is really going to speak to that. So now what we want to do is just to kind of talk about how a provider is able to complete those updates in PNM. And by updates, we're referring to any change whatsoever that would obviously need to be communicated to Medicaid. That's considered an update. Of course, you're going to choose your provider in question from your dashboard. That's going to bring you to this provider management homepage. In the Manage Application section, you'll expand the enrollment action selections, and then you'll click on the hyperlink that says to begin ODM enrollment profile update. Now, this can be done by an administrator, obviously, because they automatically have full access, or it can also be done by an agent. However, the agent has to have been given the enrollment action role. There is a role or an action that's given to the agent by the administrator, and the name of that action is enrollment agent. If they don't have the enrollment agent action assigned to them, then when they go to expand the enrollment action selections, this will always be blank for them. So just keep that in mind if you ever get any questions about, hey, how come I can't see that? It's either in an active workflow, or if they're an agent and they don't have the enrollment agent action, that would also be the reason why they're not seeing anything when they expand that enrollment action selections. Now, once they click on that hyperlink, they will get a pop-up window letting them know that they have 10 days to submit that update. Just gives them, 10 calendar days in case maybe they don't have all of the information there. Maybe they're waiting for something from the provider, depending on who it is that's initiating the update. But they have 10 calendar days to finally push that submit button. If they don't, then it's just going to delete all of the information that they would have put in, and they would just have to restart the update from scratch. And once again, if it's an administrator, they automatically have access. However, if the individual performing the update is going to be an agent, because they do have that ability, they have to have the enrollment agent role or action assigned to them. Now, sometimes the update has been initiated, but it hasn't been completed. Remember, we just talked about that 10-day period. So what happens is when the individual goes back in, it no longer is going to say begin ODM enrollment profile update. It'll kind of change automatically to say continue ODM enrollment profile update. And then they'll just be able to pick up where they left off as long as they still have time left in that 10-day period. The other way that they can also tell whether or not the Medicaid record has been fully submitted, if there's still time to be able to do that, is of course via the status column on the dashboard. If it hasn't been submitted, then that's what it'll say in that column. Now, once they've either clicked to begin the profile update or continue, the next thing that they'll see is this summary page or the update summary page. It's going to list out all of the pages from top to bottom, every page on that Medicaid record, and an update button. So it gives them the ability to make changes to specific pages without having to go through the application in its entirety. Now, I know that there's a lot of information on this screen, and depending on, how big of the screen it is that you're looking at, it may seem to be, a little hard to see. Let's kind of show this a little bit easier to see. So the great thing about updates is it can be an individual update. Maybe you only have one address that needs to be updated, or you've got a couple of things that you need to do here. PNM is built in such a way where you don't just have to submit one update over at a time. Let's face it, you might have 4 or 5 things that you need to do, and it would be terrible if you could only do one of them and then submit it and wait for that to get approved. You don't have to do that. You can do a single update, or you can do multiple updates within that session or within that submission. You would just wait until you've, made your changes to all of the necessary areas and then just send it over. And then the way that you do that is you just locate the section in question. In this case, we're going to choose billing and payment address as an example, and then click that corresponding update button. And all it's going to do is it's just going to take you to that page in the application. If for some reason you accidentally clicked the wrong section, there is the return to summary button in that top right hand corner that will allow the provider to go back to the update summary page. Then, of course, they just choose the correct one in question. Couple of things here just want to call out as we're looking at this page here. Providers do have the option on address pages to make things a little bit easier for them as they're filling these things out. If the address, whether that's the billing and payment address, the home office address, maybe the 1099 address, if any of those happen to be the same as the primary service location or the location that the practice is considered to be at, that main location, instead of having to retype the same information in, they could simply just click on this box here, check that off on the same as practice location, and then the information just automatically fills itself out, saving them a couple of minutes of having to type that in. The other thing I wanted to call out is this override address validation box. Once that's clicked, that can be utilized if for whatever reason the address in question is not in the United States Postal Service database. And we'll actually look at this a little bit further on the next slide. Just again, keeping in mind that whenever there's an update that needs to be done, you're just going to locate that page, click that update button, go ahead and make those necessary changes. The main thing that you want to make sure that providers are going to want to make sure that they don't forget is don't forget to hit that save button. The system won't automatically save the changes unless you hit that save button. So it's very important to remember to do that, or to advise providers to do that. Again, we're dealing with addresses. On every address page, the United States or the USPS Postal Service, that database, they're going to look to validate. So PNM is going to use that database to validate the address that's been entered or that's been updated. And again, that's on every address page. A lot of times it'll capitalize the letters. It may have added the correct 4-digit extension. Maybe the provider typed out drive, but the database has the abbreviation. So it'll fix that or change that. And all they're going to want to do is just to hit the accept button when this box pops up. Like I mentioned before, if for whatever reason, maybe it's a new plot of land, it's a new address, so it hasn't quite made its way to the database, so it can't be validated, PNM can't use the database to validate that address, then what the provider will want to do is to click cancel and then hit that override address validation box. Because if they don't do that, and it's not in the database, the system won't allow them to actually put that address in. Once again, want to reiterate that once the change has been done, and that's no matter what the change is, whether that's an address, taxonomy was changed, a specialty was added, that save button becomes very important to make sure that it's hit once you've made those changes. Now, the great thing about the system, one thing that I really like, is that it will let you know whether or not you've hit the save button. And it does that by placing a red dot right above the icon on the page that you just made the change to. So initially, there is no red dot. You go in, you make your changes and press the save button, and then we get the red dot. So that's more or less a confirmation to the provider that they have saved that section or that page, and the information has been stored. Now, if there is an additional update that they need to do, they don't want to go ahead and just submit this, they need to make a few more changes. Once again, that return to summary button is going to be what they'll click to go back to the summary page. Another way that the system will notify the user that that save or that page has been saved, the information has been stored. Is next to the section that you just updated, there will also be this green check mark. So we got a red dot on the page itself, but on the update summary screen, we're also going to show you that and confirm it with the green check mark. And then you would just go back in for the other page that needs to be updated and just click that corresponding update button. That's how providers are able to initiate and complete some of those updates. Another way that they're able to complete updates in the system is by updating the key identifiers. So this is a different type of update. It would still be located in the same section. They're going to choose that provider in question, expand that hyperlink under the enrollment action selections section. But instead of doing the ODM enrollment profile update option, they're going to choose the option to edit key provider identifiers. This is where you're making updates to certain kinds of information, such as that provider's name or the provider type in question, maybe the NPI number or the tax ID. The zip code is different, or the extension, or maybe the taxonomy that it was is no longer the case. So that has to be changed. Those kinds of updates are not done by going in and doing the enrollment profile update that we looked at a moment ago. Name changes, gender changes, things of that nature have to be updated by completing the update and edit the key identifiers, which is just that hyperlink underneath the profile update option. As always, once the edits and updates have been made and completed, they'll want to always hit the save button. You can't hit save too many times. That's my philosophy. So we've gone over the two different ways to make these updates. Now we have to get that update submitted over. Okay, so we've done half of our job as it pertains to the change, but ODM still doesn't know. Okay, we've just saved the information in the system. Okay, but we've got to get it submitted. And again, we have 10 calendar days to do that. We just need to finalize the update. So there's two ways to submit updates. If you're on the summary page and you've already made changes, you see your green check marks, there will be a button there that says submit update. But maybe you only had to do one change, so you didn't necessarily have to go back to the summary screen. You're on the billing and payment address screen because that was the only thing that you needed to change. You've got your red dot and you're all saved up and ready to get it submitted over. There's the submit for review button that you'll find on that page. Now, in either case, you will get a pop-up window that's going to show the section or sections, if there's multiple, that you've made changes to. Of course, in this case, it's just the billing and payment address. This is also where, if for whatever reason, this is not accurate, maybe you did billing and payment address and you also thought you did, let's say, the primary service address, but you're not seeing it here. Chances are you just didn't do it. Don't hit OK. Okay, they can hit cancel and just simply hit return to summary, go back to the summary page, and then choose the other section that they needed to update. Or maybe they did put the information in and they just forgot to hit save. If the save button is not used and there's no red dot, then that section won't appear here as one of the ones that the provider updated. But as long as everything matches up correctly, you see the section or sections that needed to have that update listed here, then you just go ahead and press the OK button. And that's where you'll get your confirmation page letting you know that you have successfully submitted that over to be reviewed. Once they click the return to homepage button, then now it's going to show a different status. So it was not submitted because we were initiating an update. We just hadn't fully submitted that update over. But now it's showing as submitted because we've gone through the process, saved everything, and submitted those changes over for review. Now, timing as far as the length of time that it takes for that updated information to appear, in all honesty, that can vary depending on the update that was performed. There are some updates that get performed that are completely automated, that PNM does on its own without having the need for a physical person to actually look at the update in question. And so obviously, because it's all systematic, that's going to go through much quicker than if it, required there to be some additional screening or some additional review. Some of the updates, such as like changes of names or specialties, those are going to obviously require a manual review by the Medicaid enrollment team. And so those manual reviews, those can take up to 30 days to complete. Like I said, other updates, maybe it's just you change the billing address. That's going to be a completely automated process. So that update is going to appear with that change the data a lot sooner. Once again, underneath the manage application section, once the provider has actually gone into and looked at, pulled up the provider in question, is the my current and previous applications section. This is where they can see things happening in real time. So for the update that we just submitted, we can see that it is processing. So is the workflow complete? Well, no, it's not complete yet. It is still in an active workflow because we just submitted that process or that update, that change over to be reviewed. I do want to take a moment and pause just to see what questions we might have. Let's see, looks like there was a couple of questions here. I'll go ahead and repeat that. It looks like John already answered. When changes are made, such as address, name change, etc., are uploads required? And if so, what types of documentation? A change of address does not require a document upload in PNM. If a primary service address is changed, however, ODM enrollment will complete a manual review and could ask for an additional document, but that would be only if it is needed. And is that a hand I see? Sarah, do you, you should be able to go ahead and unmute yourself and ask your question if you had one.
Yeah, hi. So I have a question. It's kind of in regards to a provider completing an address update of all of the tabs that have an address listed. It was completed about 4 weeks ago, and I see in PNM the status is provider screening. Now in PNM, all of the tabs have been updated except for the billing tab, which still has the old address. So since we're at the 30-day mark, almost, should I have her go back into the PNM portal And then my second question is, at what point does all of this information get transferred to ODA so that the ODA can update her chart, PIMS chart?
Typically, once it's been updated on PNM, it's updated everywhere that it kind of needs to be. Now, if you're finding that it's been longer than that amount of time, the only recourse at that point would be to reach out to ODM to check on that status, to see maybe kind of what's going on with that. You can get a lot of information by simply going in and seeing where it's at. But if they haven't seen any kind of change at all, there isn't anything different as far as the information in that my current or previous application section, then they'll have to reach out. And then it looks like Karen, do you have a question?
Yeah, I was just going to comment. Unfortunately, ODA doesn't get the updates automatically. We have to enter them in manually. And they're sent to us from PNM to our enrollment box, and then we enter them when we get them. If we haven't received it, we don't get it. So if whoever, I didn't see who was speaking, but if you want to email us who it was that changed their address, we can check we save all the emails so we can check and make sure we didn't miss one.
Okay, Karen, I can send that over to you. I just don't know if if it has been completely processed within PNM, if that's why it hasn't been sent over yet. Although PNM on all but one of the tabs is updated, it still says status provider screening. So I don't know if there's an issue with it, if the provider needs to submit documentation. I don't know. So
if it's still in provider screening, it's just still being reviewed. If additional information was needed, it would say return to provider. So since it's not saying return to provider, they're not looking for any information from you currently. They're just, and I can't speak to why it's taking the time that it's taking, but it is still being updated. All right.
Thank you.
Sure, no problem. So what I'm going to go ahead and do now, for the sake of time, is to turn it back over to Jamie. She's going to walk through a display of the system and cover some of the things that we just discussed throughout the provider section.
Thank you, Jerron. Yeah, let me switch my screen here and we will look at a dashboard of that a provider would see. So we'll go through that experience in the training region and what that would look like for you when you're helping a provider via email, over the phone, however you take in these requests. So first thing I wanted to show you that actually is a very helpful tool for providers who have multiple pages on their dashboard. Like for example, this one, you can see it goes up to 4, but there's a lot of people who have dashboards that have a lot more pages than that. And when they need to sort and filter through their dashboard to find something faster, it's a really great time-saving thing to know. So wanted to point that out to you so that you can also share that, but also because I need to look at completed statuses in order to show you how to make updates. So I want to look over here at the status column. These white kind of fields that are in between the head, like the title and the information, you can click on like the filtering looking image. For statuses and specialties, you can see both of those have drop downs though. So I do want to filter the status. I want to find the completed ones. So I'm just going to click on completed. It's going to skip a beat real quick, and then it will present me with the completed Medicaid IDs on my dashboard first. So there is just kind of I think one full page here. So got a lot of different statuses here, but the filtering really helps. And so just wanted to share that with you so that you could share that with providers, maybe if they're getting overwhelmed, looking through their dashboard for certain things, it can really save some time. So what I first want to do, before I move on, somebody asked about revalidation earlier and things of that nature. And so I just wanted to scroll up here and look at the column headers that a provider is going to see from their dashboard. And over here to the far right is the revalidation due date. It's something that they can see at all times. That column does not disappear. It always will have a date. But the interesting thing is, and that we have found that providers have also, kind of struggled with this concept as well until we've clarified it. But when someone needs to make an update to a record from their dashboard, if they are outside of the revalidation time, so some people have to do it every 3 years, some people every 5 years, but when they're up that year, their record 120 days before that date will show a link that they can begin their revalidation. So if a provider goes into their file and they're looking for a button that says begin update, but something says begin revalidation instead, it just means that we are within that revalidation due date time frame, and that if an update is going to be made to this file, that it needs to happen via the revalidation. If we are not within the revalidation time period, then we can move forward with how we've presented it to you thus far, which is you go into the file and you begin your update. So just wanted to call out the relationship between updating the file outside of a revalidation time period or due date time period and inside that period. And so if a provider is struggling with that concept, helping them with that as well. So on that note, what I want to do is click into this very first provider file on my dashboard. We can see the revalidation due date is 2026, so we're definitely not within that time frame. And so I'm going to go ahead and click either the registration ID or the provider name to get in there. We're going to update a page from the file. So how we begin this is with the enrollment action selections that says begin ODM enrollment profile update. When we are within that revalidation time period, it will say begin revalidation. So if someone gets in there and they're like, I'm trying to update my file, but it's making me revalidate. Well, it's because we're within revalidation and that's why. So you can still update the file, but the link would be titled differently. So because Amanda, this provider, is not inside that revalidation due date, we have the link that says to begin an update. So before I click on that, though, I just want to call your attention down here to the bottom that we are able to make this update to this file because it's not in any other workflow. No one's messing with it. It's not in the middle of any process. It's good and it's state and ready to take on an update if needed. So we can tell because there is only one workflow item listed on the chart, but it is completed. If you see that Y over there on the right side. So let's go ahead and click on the Begin ODM Enrollment Profile Update. It does present us with this pop-up that says you've got 10 days to make this change and submit it, or else you'll have to start over. So I'll click that. It's going to take me to a new screen that Jerron did show us kind of the smushed version that has everything, and then kind of a close-up version that you see right now. So I'll scroll down. This is the update summary screen. This is what we refer to it as with providers. So if you want to refer to it as the update summary screen, that's what we can all talk about it as. So let's scroll down. We see the most common updates are at the top. And then it breaks it down with those blue lines kind of into sections. But you can see that there is a update button in front of each page within this record. So they can individually update a part of the record by clicking the button in front of the name of that page. So for this particular example, to update Amanda's file, we are able to select an option. So let's go up to an address. We've had discussions about addresses and things, so let's go up to addresses. Let's change the billing and payment address. I'm going to click on that. And it takes me right to the billing and payment screen. And I can see the existing information that Amanda has for the billing and payment address. I am going to change the address real quick. I'm gonna put in New Albany. And our zip code extension. Okay, so here is our new billing and payment address. I'm going to scroll up because I want you to see the top. And what we want after a change is made is that red dot over here next to the page. So if a provider says, I see the red dot, okay, perfect. That means that they have clicked save. So they put it in. I'm going to click save right now so that you are going to see that, yes, it's reviewing that address. They get that pop up letting them know, hey, is this the correct one? But we do need to click save an additional time to get that red dot. So any address page will get that pop up. So that needs to be clicked first and then save because we need this red dot to be available right here. From this page, we can return to that summary screen that has all of those provider buttons going down, or the update buttons going down the middle, or we can go ahead and submit for review. So because I want to show you the green check mark that shows up on the review summary page, I'm going to go back to that one. So let's click return to summary. It will give another pop-up that says, hey, you've started an update. Okay, great. We do need to submit for review. So it's an additional reminder for providers that clicking save, getting that red dot is not enough to make a update go all the way through. When I scroll down on our address information, we did update the billing and payment address. When we were looking at the navigation bar going left to right, we saw the red dot on billing and payment address stating, yes, a update was saved. On this summary page, we see the green check mark. Both indicate the same thing. We can submit for review from this page as well. But there has to already have been at least one green check, because up here in the top right is the submit update button, but that one is not available until an update has been made. So you can submit from this page once you've made an update. Maybe you need to make another one, so you go and click on another one. But you can submit from inside the navigational bar type looking page as well. So when we click submit update, that is the final step to make an update go through. And then it gives you a pop-up. We have modified the following sections in our application. Click OK to complete your submission. So saving, submitting, it's 2 steps. Once the update has been submitted, they will get that submission confirmation. When they go back to their home page by clicking that blue button, let me filter this again, get my complete ones at the top. Oh, you know what? Just kidding. I'm going to get my submitted ones at the top. All right, so Amanda Bramlett, who is the 4th one down, we just submitted that new billing and payment address. We saw prior to this that the status was completed. Now it says submitted, and that is because we have submitted an update. It has recognized that. And when we go back into Amanda's file or record, if we click into it from the dashboard, we see that there is a new item down here in this current and previous application section that lists out all the items that are in a workflow. And we do have a new one that says update registration, and it has submitted in its status column, and it has an N under the is the workflow complete, because it's not. Once this turns to a Y, the workflow will be complete and somebody can make another update or do something involving the enrollment actions. Because until then, until that's processed and says a Y, the provider will not be able to get back into this section that they found that begin update button. It has to go through, get processed, and this N will turn to a Y, and then they will be able to expand this to begin doing something else within there. Any questions regarding that? I did see we had something in the chat. I believe we are reviewing that as a team, trying to figure out a good answer for you. All right, I am not. So the question is, if a provider is certified for OHCW and wants to now apply for Passport, can they do this from their PNM pages? So excuse me, I was just reading something else. So I'm not aware of Passport being indicated within PNM. Maybe from someone from ODA could, or ODA, yeah, ODA could speak to this. Karen has her hand up.
Yeah, so the ODA services that are in there, they are either Passport or there's assisted living waiver. So all the services, for the most part, are going to be Passport. And yes, they can add the Ohio home care waiver. I don't know how to add a specialty, though. I haven't had a provider ask me that yet, but I know that they can do it because we have providers who are already in DODD or Ohio home care waiver adding aging, but I don't know how to add it.
Okay. Thank you for that answer, Karen. So if it is a specialty, they can update that under the specialties page. So if we went, and I can go back to my dashboard real quick because I can't do anything with this one. Let me go back to a completed one real quick. So for example, if we wanted to change specialties, add specialties for Andrea Miller right here. We have this as a provider type 96. I'm going to go into the file and we do get a chance to begin the update. And when we get in there, well, after clicking through the pop-up, but when we get in there, we will navigate to the specialties right here, which is in the licenses and classifications section. So if we click on specialties or the update button, excuse me, it will take us to this page. So the existing primary specialty will be listed, at least that. And we know it's the primary. There is a column on this page that indicates that yes or no, if it is or is not the primary. So this one is. And if they need to add a additional specialty, they can click the Add New button. The specialty dropdown will relate to the provider type that it is. They can choose a new, whatever one is listed there. The particular start date for it, and then the end date auto populates on its own. So if they just make these selections, anything that has a asterisk has to be filled in, but then clicking save to get that red dot. So if I scroll back up here, sorry, duh, I'm sorry. I just picked the exact same one. Oh my gosh, I'm funny. Okay, click save. We will get our red dot. It will be added in there. I'm so sorry. I was trying to add the same one. And so then they can change that. They know that it's been put in there, but they do need to submit that one for review, in which they would get the pop-up that the specialties have been updated, and it will take them to that confirmation page as well. So any thing else that I can answer before I turn this back over to John?
Thank you so much, Jamie. I know we're past our scheduled time, but I do want to conclude today, as I mentioned, with some opening up for questions. And I know we've had some questions come in that have been answered so far on this session. But we were sent some questions ahead of time for this this presentation, and I wanted to highlight those first. So they may be common things that you've come across or users have come across before. So I just wanted to kind of talk to those, and then we'll open up for any additional questions. So the first question, some of them were related to being stuck in PNM or not allowing to progress further. We mentioned that a little bit earlier. Really, the best way to kind of figure out those issues or try to work through those is to contact the ODM Integrated Help Desk. Now, you can do it via phone or email. If you call via phone, that 800 number, 1-800-686-1516, and then choose option 2, followed by option 3. By using the phone number, that will get you to a person instantly, and you can be able to express your issue, whereas the email may take a little bit longer to get a response. But if you do send an email, and I'll put the contact information up once again here before the end of our session, if you do send an email, including screenshots of the issue or the screen that you're on or the issue that you're facing, can be helpful to resolving that. Another question that we received is for those helping providers, why when the provider logs in is their dashboard blank? No providers are listed when they log into PNM. So if they are brand new to PNM, if they've never logged into PNM before, they won't have any providers that appear on their dashboard the first time that they logged in. The assignments are completed two ways. If they are a provider administrator user and need to have access to existing providers, ones that already are in PNM in the system, they would need to contact that integrated help desk to be assigned those records to their provider account. Now, to do that, the provider themselves would need to fill out that we've highlighted here at the bottom, the provider administrator request change request form. This is available on the ODM website, but for somebody to become an administrator for an existing provider, that Medicaid ID that they're trying to become the administrator for, that person would need to fill out that change request form and email it to PNM support at medicaid.ohio.gov. Now, if they log in and they're a provider agent, agent assignments are done by the administrator. So if I'm a provider agent, the administrator would need to grant me rights or accesses to that provider's record. So those are kind of the differences between the two roles there. We did have a question regarding PAA staff. Are they able to complete changes or updates for a provider on behalf of a provider? Really, the only way that this would work is if you had a provider account set up. Now, it could not be the same one as your internal account. So if you have an internal account, it would have to be a separate Ohio ID from that account if you wanted to have a provider role such as an administrator or agent. Then that provider would need to set you up. Either you would become the administrator or the administrator would set you up as an agent, but that's really the only way, have that separate provider account for you to go in and make changes on behalf of a provider. That would be the only way that could be completed. And then the last question, it says, is there a way to see where a provider is at in the review process so we can assist them with moving the process forward? And that was what we looked at earlier with those internal statuses. We can get an understanding of the status of where it is. We had that question earlier. Providers, it's still in provider screening. It's been there for a while. You can check that under that workflow steps page. And we know that provider screening relates to the provider enrollment, so we can contact the Ohio Department of Medicaid enrollment team through that integrated help desk number to try to understand, a status or something moving forward. So we can locate those statuses or those notes that we looked at previously in the header as well. So those are some questions that we received ahead of time, and those may be common questions or questions that you have. Some of them I know we answered during the session, but just wanted to cover those. So again, I know we're past our scheduled time for today, but just for the final part of our training, I did want to open the floor one last time to ask any questions that you may have about the PNM system or any clarifications on things that we may have covered during today's session. Again, you can utilize the chat within Teams or utilize that raise hand feature. We'll be happy to take any final questions before we conclude our time with you today. I did see a question in the chat. It says, what is the email address the notice would come from? All notices from PNM come from, I believe it is ohpnm@maximus.com, I believe is the email address that it comes from, but it should indicate that it's from PNM, and typically in the subject line, it's going to indicate what it's for. So if it's from for a revalidation, something like that, it will indicate that in the subject line. And then the body of the email usually directs whoever receives that to log into PNM and locate the information under provider correspondence. Are there any additional questions or anything else anybody would like some final clarification on? Again, I'm going to put up the contact information.
Hang on, John. Hang on.
Yes,
We have a question in the room.
Okay.
Email to get access. I have a couple staff that don't have that full access. And then do we need to send that 7078 to show their availability?
So I think that the question was about an email address to gain access to PNM. Is that right?
Correct.
Yeah, so if you want to send an email, the address is IHD, which stands for Integrated Help Desk, so IHD@medicaid.ohio.gov. You can just send to them, what you're looking to do. If there is any additional information that they may need regarding those accesses, they can reply and ask for that. But that would be the first step, is just the one listed here, the IHD@medicaid.ohio.gov, and then they can look to get the proper accesses or roles set up for those users in PNM. Any other questions? Yeah.
I do have a question. On slide 48, it states that NPPES registry needs to match before a provider can change their name. So do they need to go update the NPI information before they update the PNM?
Correct. Yep. So since PNM is checking against the NPES registry database, if there's any changes, those would need to be updated with NPES prior to making that change in PNM to make sure that when PNM does that check, it's matching the information that the NPES registry database has.
We have a question. My name's Holly with PA9. We have an ERS provider that wants to expand and add like a medication dispenser. When you review the specialties, that's just the peer source, not the services that a provider is providing, correct?
Yeah, the specialties is related to the provider type selection. So as Jamie showed, it is kind of a drop down menu, and those are based off of the provider type that is selected. So if there are things that potentially need to be added as a specialty that aren't appearing in that drop down list, users can contact ODM enrollment directly to potentially add those. But yeah, that field or that page is, like you said, it is specific to those specialties. Any other questions? Again, if you do have questions, I'll put up our final slide here. If you do think of anything kind of after the fact today, or as you're going through later today, tomorrow, rest of the week, you can reach out to our team directly. Our email is ohiotrainingteam@maximus.com. So if anything comes up that you may think about later today or into the rest of the week, please feel free to reach out to us as well. We'll be happy to answer your question, or if we aren't able to answer it right away, look to those who will be able to provide an answer for that. So again, thank you so much on behalf of Jamie and Jerron. We appreciate your attention during our presentation today and hope that all of you have a wonderful rest of your day. And thank you again for the opportunity to take up some time during your quarterly meeting to go over different functions within PNM. So thank you so much.
Thank you, John.
Thanks, John. Thank you all from Maximus for helping us out today. So at this time, we're going to take a lunch break. You guys could be